Some common digestive disorders include GERD, which is gastroesophageal reflux disorder, IBS, which is irritable bowel syndrome, and IBD, which is inflammatory bowel disorders. Now, with GERD, what often happens is there is a kind of backwash or backflow from our stomach. The kind of acid or digestive food comes back up from our esophagus, getting and can regurgitate into our mouth, actually. Now, most people have experienced acid reflux on occasion here and there, but GERD is when this acid reflux happens repeatedly and constantly. Some common symptoms include chest pain, burning pain in the chest, regurgitation of some sour or fluids or liquids. And in Chinese medicine and acupuncture, we view GERD as a uprising of stomach qi inappropriately. Normally, our stomach's job is to push and bring that qi downwards. But when there is an issue or an imbalance or blockage, the stomach can rise up. And that's going to be our goal in treating GERD, is to focus on calming down the stomach qi, calming down the body overall. Now, IBS is a chronic digestive condition. It usually is diagnosed when you have a group of symptoms combined together. That's stomach pain, that's repeating, you have diarrhea or constipation, any kind of change in bowel movements, could be one, could be other, could be both, and as well as bloating and any kind of abdominal discomfort in that way. With IBS, there is generally a disharmony between our digestive organs, which is the spleen, stomach in Chinese medicine and acupuncture, or there could be a disharmony between the liver and spleen. Liver governs more of our emotional response, and people who often get stressed can get digestive issues like bloating or diarrhea and constipation. So when that happens, the liver is acting too strongly upon the spleen. So our goal is either to kind of restore that harmony between the spleen and stomach, or restoring the harmony between the liver and spleen. For inflammatory bowel disorders or diseases, IBD, usually what happens is there's a chronic inflammation along the GI tract. Now, two main forms are going to be ulcerative colitis, and the other form is called Crohn's disease. Now, for ulcerative colitis, this focuses on the inflammation on our large intestine. There could be sores or ulcers located in there, creating quite a bit of pain and discomfort. Crohn's disease is typically inflammation along the GI tract, but more commonly than anywhere else, it's actually in the small intestine. With both disorders, the goal really is to decrease that inflammation, monitoring the diet as well. In Chinese medicine and acupuncture, we usually view this as a weakness or a damage to our digestive system, specifically the spleen and stomach. It's damaged by what we call external pathogens. This can include heat or dampness, and there can even be blockages like a blood stasis or stagnation. Blood isn't fully moving through these organs, nourishing these organs. And our goal through that would be to eliminate those heat or damp pathogens, or to restore normal flow of our blood and qi and energy overall in our digestive system.